Trust. It's the foundation of healthcare, the lifeline between a patient and their caretaker. But what happens when that trust is shattered? When the person entrusted with your life becomes the one to end it? This is the story of Charles Cullen, a nurse who hid a deadly secret behind a mask of compassion. A man who would become known as one of the most prolific serial killers in history, the Angel of Death. Charles Edmund Cullen was born in West Orange, New Jersey in 1960. His early life was a cocktail of tragedy and hardship. He lost his father before his first birthday, and his mother, who was his guiding light, died in a car accident during his teenage years. Grief-stricken and lonely, Cullen attempted suicide multiple times, setting a dark tone for his future. Despite these struggles, he found a calling in nursing, a profession dedicated to healing. After graduating from the Mountainside Hospital School of Nursing, in 1986, Cullen started his career at St. Barnabas Medical Center. He appeared to be a dedicated and compassionate nurse, a comforting presence in the halls of the hospital. But beneath the surface, a sinister pattern was beginning to form. Cullen's first known victim came in 1988, a patient at St. Barnabas. Cullen administered a lethal dose of medication, masking it as a medical error. Over the next 16 years, Cullen moved from one hospital to another, slipping through the cracks of the healthcare system, leaving behind a trail of unexplained deaths. His methods were cold and calculated. Cullen would inject his victims with lethal doses of drugs like digoxin, insulin, or epinephrine, substances that could easily cause a fatal heart attack or other deadly complications. His actions were masked by his calm demeanor and his seemingly helpful nature, which made him invisible to suspicion. At each hospital, Cullen's behavior raised eyebrows. Nurses noticed that patients died mysteriously when Cullen was on duty. Whispers spread among the staff, yet hospitals failed to act decisively. The healthcare system, concerned more about its reputation than investigating thoroughly, allowed Cullen to resign quietly or simply fired him, enabling him to continue his deadly practice at new facilities. It wasn't until he reached Somerset Medical Center that his facade began to crack. Here, Cullen's behavior caught the attention of hospital administrators and coworkers. The hospital's computer system flagged his unusual drug requests, and Cullen was found accessing the medical records of patients who were not assigned to him. This triggered a series of events that would eventually lead to his downfall. By now, suspicions had grown. Staff members reported their concerns, and in September 2003, Somerset Medical Center contacted the authorities. Detectives Tim Braun and Daniel Baldwin were assigned to the case. As they reviewed the patient records, they noticed a disturbing pattern. A number of patients had died of unexplained causes, often during Cullen's shifts, and the deaths were linked to abnormal levels of medication in the victims' bodies. The detectives gathered evidence carefully, tracking Cullen's movements and actions within the hospital. They monitored his conversations, gathering enough evidence to confront him. In a carefully orchestrated sting operation, police moved in. On December 12, 2003, Charles Cullen was arrested at Somerset Medical Center, ending his long and deadly career. During interrogation, Cullen confessed to the murders, admitting to killing at least 40 patients, though experts believe the real number could be much higher, possibly in the hundreds. Cullen justified his actions by claiming he was ending the suffering of his patients, a twisted form of mercy in his mind. His confession sent shockwaves through the medical community, highlighting severe lapses in hospital oversight and the failure of institutions to protect their patients. In court, Cullen showed little remorse. He was sentenced to 11 consecutive life sentences without the possibility of parole, a fitting end for a man who took so many lives without hesitation. The case of Charles Cullen prompted hospitals across the country to implement stricter controls over drug administration and improve monitoring systems, aiming to prevent such a tragedy from ever happening again. Cullen's story is a haunting reminder of the vulnerability inherent in the healthcare system, a place where the people we trust the most might become our worst nightmares. The tale of the Angel of Death leaves us with a chilling question. How many more lives would he have claimed if no one had dared to question his actions? And even more disturbingly, how many others like him might still be hiding in plain sight, cloaked in the guise of caregivers? As we reflect on these questions, we must remember to remain vigilant, For trust is a precious commodity, and sometimes even angels can fall.